The world is facing an unprecedented health crisis. But COVID-19 is not just a health crisis, but also a social, economic crisis, threatening not only lives, but also jobs, businesses, and even the global economy. It's hitting developing countries much harder, where the health system and economy are more vulnerable to damages from COVID-19, where resources are scarcer and capacity is weaker. The problem is, the world is very much interconnected, which means the world has a lot more to lose if we choose to close our borders and wait it out. So, we are faced with a dilemma. Openness and active interaction mean that the virus can travel faster and wider. If we go the other way, it may cause serious damage to the economy and our livelihoods. Managing a global pandemic while minimizing damage to the global economy cannot be done alone. We need a collective approach. And one of the most useful tools we have at hand to overcome the global challenge is knowledge sharing. This year, CID at KDI organized a research team and took a deep dive into the most pressing matter that requires knowledge sharing: how Korea is dealing with COVID-19. On February 2020, Korea had the highest number of confirmed cases outside of China, but quickly succeeded in getting out of this trajectory. So what were the key factors in Korea's response? Korea quickly mobilized key institutions from public and private sectors and organized them into an effective cooperation mechanism. First was cooperation within the government and health authorities. Roles and responsibilities of central and local government bodies were streamlined under the Prime Minister. Health authorities rapidly came up with strategies for mobilizing medical equipment, and personnel and emergency measures were put in place. The Emergency Economic Council became effective with task teams for finance, industry, and employment sectors. This allowed fiscal policies to be implemented very quickly, which alleviated the pandemic's damage to the economy. Schools and education authorities also sprang into action. The authorities immediately organized a countermeasure task force and prepared for the transition into online classes as soon as schools were closed. Guidelines were improved and digital equipment was procured on a fast track, and support measures for teachers for online platforms were implemented. Secondly, public-private cooperation played a key role in applying technologies and solutions to tackle the virus. It was particularly important for 3Ts: testing, tracing, and treatment. Private hospitals and the health industry collaborated with the government from very early stages of the pandemic. This was especially important for fast-track authorization, development and production of test kits, and fast-track adoption of innovative proposals. Big data from telecommunication credit card usage helped to track the routes of confirmed individuals and their contagion. This was possible because the legal changes were already in place. The track location and payment information were utilized as one of crucial tracking measures. Tech companies were indispensable for education, quickly granting mass access and connection for online classes on a national level. Thirdly, active civil participation was another key factor. Measures such as social distancing, hygiene protocols, and self-diagnosis were not only met with voluntary compliance, but also with active participation in helping in any way to flatten the curve. All this was possible because there were significant underlying factors. This accumulated readiness is something that merits attention. Korea's health system is very efficient in terms of accessibility and effectiveness. The National Health Insurance, introduced in 1989, kept health expenditures low, which meant cost was not an issue for diagnosis and treatment. This enabled Koreans to see doctors easily and frequently. Korea's ratio of medical personnel and patients are high. Doctors are used to seeing many patients and dealing with diverse cases. Korea has also been a leader in ICT technology, which proved to be vital for crisis management and disseminating information to the public. More importantly, Korea applied the lessons learned from a previous crisis in 2015 for Middle East respiratory syndrome coronavirus, known as MERS, and introduced institutional and legal reforms for dealing with epidemics. This legal measure proved to be critical. It allowed access to telecommunication data, which was used to track movements of confirmed cases. This allowed rapid responses to be implemented without dealing with legal conundrums. Stakeholders knew what to do, what was allowed and what wasn't. Despite its success, there are yet several issues to be discussed and resolved. First, containment method. A total lockdown of borders and cities can curb the spread of the disease, but puts a great strain on the economy. The government needs to find a way to contain and manage the disease while avoiding a total lockdown on citizens and economic activities. This dilemma between lives and livelihoods calls for a viable strategy to manage the pandemic. Second issue is the balance between public health and individual rights. The MERS crisis of 2015 led to legal measures that temporarily restricts some individual rights to protect lives of other citizens. But the question remains, to what extent? How can we balance protection of individual liberties and yet ensure alertness to prevent health crises caused by carelessness? Furthermore, there are issues to be addressed in healthcare system as well. Due to devoted sacrifice of medical personnel working well over burnout levels, we were able to flatten the curve. This cannot work in the long term. Additionally, clinics and hospitals designated as screening and treatment centers faced considerable management risks. These issues should be addressed by improving the current health system to become more sustainable. Lastly, similar problems were acutely evident for education. Until now, Korea has demonstrated comparatively high level of ICT-based education. But this was limited to private and after-school activities. Online education was very limited in public education, which caused significant challenges to transition into online schooling. It is painfully clear that COVID-19 is not going to end anytime soon, so a long-term approach is needed. Response and recovery are not enough. Reforms have to follow. Korea's experience so far can give us lessons in two very important shock absorbers for the long haul. First absorber is systemic mobilization, most notably the healthcare system and crisis governance. If it is well organized and able to allocate resources and personnel, it can absorb bigger shocks. There is more time for measures for flattening the curve and less confusion in the process. It is critical to procure time to respond and recover before being forced into the dilemma between saving lives and saving livelihoods. The second absorber is digitalization on various levels. The pandemic may force lockdowns, which can deal serious blows to the economy. But if social and economic activities can take place virtually, effects of social distancing and movement restrictions can be ameliorated. The same goes for education. Korea is accelerating digital transition because it will be the key in assuring survival of households, jobs, and companies from economic ruin. What is past is prologue. What we witnessed in 2020 will not just disappear into the past next year. No other time in history has witnessed an age where international development and cooperation has become more vital. KDI took the initiative in packaging the experiences of Korea and strengthening the drive to share it with the world. For a global response, sharing is not enough. There has to be mutual learning. We have to teach and learn from each other more effectively. It can give us many lessons, but it is still experience that of a single country. What Korea has experienced may not be applicable in other contexts. Knowledge sharing can take what works and emulate it elsewhere. But it works only if we learn from each other. We hope this video may help to take a step into this quest, to share and collaborate with the global community.